Dr. Nardi here, back with another video. And in this video, we are going to talk about bipolar disorder. Now, we can divide bipolar disorder into two distinct diagnoses. Bipolar 1. Now, when you think about bipolar 1, this is more of the classical description of bipolar disorder. Basically, it has a clearly recognizable episodes of mania and depression. A person with bipolar 2 does not present any obvious episodes of depression, and the manic episodes are more brief and less intense. And because of this, bipolar 2 often goes undiagnosed. Now, we can think of bipolar disorder in terms of inheritability and genetics. So, for example, monozygotic twins have a 40 to 45% concordance rate, whereas dizygotic twins, or first-degree relatives, have only about a 5 to 9% chance of inheriting the illness. Now, if you're thinking about somebody who has bipolar disorder, whether 1 or 2, you always want to rule out any kind of underlying medical condition that may cause mania. For example, influenza, a brain tumor, or encephalitis may cause bipolar disorder. So you want to make sure there's no underlying conditions. The other thing you would look for is you want to look for any kind of drug use that might cause bipolar disorder. And the drugs that could cause this are antidepressants, cocaine, steroids, or stimulants as well. Now, the question you might be wondering is, how do we treat bipolar disorder? Well, you can use tricyclic antidepressants. You could use those to treat bipolar disorder. However, the most common is lithium. Now, this is the most commonly used mood stabilizer. The reason for this, it's effective and inexpensive, again, compared to some newer drugs like TCAs. It also has some cautions associated with the use of lithium. So there's some adverse effects that could happen on the thyroid gland. There could be some kidney impact, could impact your heart. If you're pregnant, it could impact a developing fetus, and it also can cause a benign elevation of white blood cells. Here's the thing. Lithium is very effective, but it has a very small therapeutic window of effect in terms of that dose response curve. So what that means is you want to keep a very close eye on it. If someone is taking lithium, you want to monitor them very closely, get them blood checks every month or so, just to make sure that there is nothing going on. Interestingly enough, lithium increases synthesis of serotonin, a neurotransmitter. So it does this by enhancing the release of serotonin. It also increases the rate or synthesis of norepinephrine in depressed patients. That's kind of how it works. And it decreases the rate of norepinephrine in manic patients. So that's how it's good as a mood stabilizer. It also blocks the postsynaptic dopamine receptors. So it kind of blocks that extra dopamine binding. It also has a direct or indirect effect on G proteins. Now, these G proteins mediate the balance of neurotransmitters. We are talking dopamine, epinephrine, and norepinephrine. So basically, it stabilizes the mood by increasing the central nervous system and the levels of serotonin within the central nervous system. Another drug you could potentially use are anti-convulsants and antipsychotics. Now, you could use these for the treatment of bipolar disorder. However, these have side effects as well, such as sedation, weight gain. They can cause tremors, liver toxicity, and potentially pancreatitis. Antipsychotics, also known as second-gen antipsychotics, are also used in the treatment of bipolar disorder. However, again, as I said, the most common is lithium. Thanks for watching this short video on bipolar disorder. Make sure you like, subscribe, and share this video. If you have any comments or suggestions, please leave them below. And I will see you all next time. Take care. Bye for now.